Before VAST was created, when patients came to our department with psychosocial needs, they generally had their physical and mental health needs met very well by our clinical staff. But then we would sometimes fall down a bit when it came to giving a comprehensive intervention for the problem that was underlying that physical or mental health need. And so by bringing VAST in, we've been able to tie the two together and have specialist team members who work alongside our clinicians to provide a really robust psychosocial intervention.
36-year-old female victim of domestic abuse. For an emergency department, VAST brings screening, identification, risk assessment, information giving, signposting, advocacy, referral and safeguarding.
So much of what a patient needs at a time of vulnerability in their life is nothing to do with medicine. I think for me, the introduction of VAST has really improved the quality of care we offer, and I think that's fantastic globally and specifically.
Can I have VAST to minus, please? Thank you.
At times of high service pressure, having VAST focus on the patient's psychosocial needs allows us as clinicians to focus on their clinical needs.
So my boyfriend, he gets really aggressive when he gets drunk, and then this morning he pushed me over in the kitchen and I fell really awkwardly and I've broken my wrist.
What we've been able to do with VAST is that they are able to refer people directly on, and this means that from the patient perspective, as when they go home from hospital, they already have in their hand a plan and a time that they're going to see somebody again. And I think that from a patient perspective is really very helpful.
So you're not the only one in this situation, and I'm glad you've come to us to get some support. I would like to refer you to a community service that will support you.
When you're working in commissioning, you have an awareness of the whole range of services out there, so your substance misuse, your mental health, smoking cessation, as well as the acute setting, the hospital. An individual now was seen in a much more holistic and round way. What we did find in the early days was actually, rather than just a single referral to an agency, the VAST worker would be referring the individual to a number of different services.
People attending A&E would be treated and then may leave and not come to the attention of the homelessness services, and then just represent again and be a frequent attender. Having a joined up referral system with the hospital, the A&E department and the discharge team enables us to do our job better and identify those people that need the most help.
I think once people have something like a VAST team, they never go backwards, but it's having the leap of faith to think that's what we're going to spend a small part of our budget on.
It's good for the individual, it's good for the system, and it's good for the services, so why wouldn't we support it?
VAST has made a huge difference in Southampton, and it could make a difference to so many other people in presenting to emergency departments in other parts of the country.
Thank you so much. No one's ever listened to me before. I've never really known what to do about what's going on. I feel so much happier.